there was talk not too long ago that we were going to get to the point, or we were transitioning to the point, and this was, by the way, this was echoed by some public health leaders, that we were going to transition to COVID being endemic. It's just one of several respiratory viruses that are out there that we have to be careful of, like influenza every year. And that this wearing a mask would eventually become an individual decision, kind of like how after SARS in Asia, you look at Korea or Singapore, there are people who just wear masks wherever they go. So what point are we at? Are we at that point really, or are we not at that point yet? I think there's a lot of confusion about that.
Sure. So first of all, endemic levels of disease means it's a level of disease that we anticipate, we expect, and we find workable. I have written about this. I've talked about this. I am unwilling to accept this as our endemic level. We will get to one. We've just passed 1 million deaths from COVID-19 in the United States. We cannot save those lives we've already lost, but we can save a lot of lives in the next week, in the next 2 weeks, in the next several months. And I'm not willing to accept this as our endemic level, but we will get to it. And we will get to a place where individual decisions about masking is exactly what we should be doing. Everyone can determine their own level of risk that is acceptable to them. I just don't feel like we're there yet.
Let's just talk a little bit about what that means. I mean, it's just a little bit more about moving to an endemic status, and that doesn't mean harmless.
No, endemic does not mean mild. It doesn't mean harmless. You can have endemic levels of really aggressive diseases, but it does mean it's predictable, and it might be seasonal. It might be in particular areas where you see it and other areas where you don't, or in certain populations versus others. This is something that kind of COVID-19 kind of rolls through the United States in a fairly predictable pattern at this point in time, but does not have a great seasonality to it yet, although we keep anticipating that it will. But endemic levels mean this is what we can anticipate every year. This is what we're going to see. I am unwilling to accept more than 300 deaths a day from something that is vaccine preventable. The deaths are vaccine preventable as endemic. And so to me, I think of that word very much as predictable, acceptable. We should count on it. I don't think we should count on 300 deaths a day from this and say, all right, we're here. There's nothing really else for us to do about it.